We spent 7 hours together on the first day, December 10th. Not necessarily together because there was a 1 hour lunch break and about a half hour with breaks split up through the day. And then on the 17th, we spent a little more than 8 hours in the evaluation from start to finish, with a 1 hour break and another half hour of breaks distributed throughout the day.
As a result of the work that you performed, did you form any opinions with respect to Ms. Hurd?
I did.
What were those opinions?
The results of Ms. Hurd's evaluation supported 2 diagnoses: borderline personality disorder and histrionic personality disorder.
What is a diagnosis?
A diagnosis is a way that that psychologists, psychiatrists, anybody in the mental health field thinks about a disorder. It helps us to communicate a set of symptoms that a person is experiencing, and along with that set of symptoms, it tells other professionals a lot about how those symptoms might have developed, how that person might behave, perceive the world. It also drives treatment. The real purpose is to determine what sort of interventions will be most effective for the person.
Yeah. Previously, you made reference to, I think you called it the DSM-5. What's that?
So the DSM-5, that stands for the Diagnostic Statistical Manual, version 5, and that contains every diagnosis we use in mental health, and it's the authoritative manual of mental diagnoses. Is
performing diagnoses something you typically do in your line of work?
Yes.
Thank you. So you referenced 2 personality disorders. What's a personality disorder?
To understand a personality disorder, I think it can be helpful first to kind of define personality. So personality, something we take for granted, but these are the traits, the characteristics, the way we think, we feel, and we act that make us who we are. And these traits are pretty stable over time and across situations. We might, be sure to mind our P's and Q's when we're meeting somebody new, but overall, if somebody were to describe us, or if we were to describe ourselves, we have a pretty good sense of who we are. Sometimes an easy way to think of it is imagining how you might describe a brother or sister or a child if you have children. Their personalities are pretty clear to you. A personality disorder is some sort of dysfunction in those enduring traits. So as opposed to other types of mental illness, when you think about something like depression, that's episodic. It comes and it goes, and when it's treated with medication, it can pretty much be completely mitigated or minimized in a person's life, and their personality is still there, separate from the depression. When we have a personality disorder, there are going to be disturbances in several different areas that are visible in almost all different facets of their life.
Is there a manner in which personality disorders are commonly diagnosed?
Yes, so they can be diagnosed in a treating environment. Treating psychologist or a therapist or a psychiatrist simply does a diagnostic interview, which involves assessing multiple areas of a person's history back down through childhood.
I'm going to stop you for a second.
Yes.
What's a treating environment?
Sometimes I'll slip into these words, I apologize. So a treating environment in therapy, if somebody is going in for treatment, the mental health provider will ask them questions to find out what sort of symptoms they've experienced and what sort of things have occurred in their life that might be consistent with these disorders, or rule out these disorders, prove that there's no reason for these disorders to be considered. They might also pay attention to their observations of the client over time and new information the client provides them. The most reliable way, however, to ever come about a diagnosis really is through a comprehensive psychological assessment. And I might use the words assessment, examination, testing interchangeably. They all mean the same thing. It's combining information from multiple different sources. One main source is psychological testing using validated objective measures. That means that they've been tested, they've been shown to be accurate for testing what you want to test, and in the environment you're testing. So there are measures specific for court environments where someone might respond differently. You integrate that with the same interview I was telling you that people would do for therapy. We do that as well. And then in a courtroom setting, you're going to look at all the legal records, all of those documents, corroborating information to sort of check your hypotheses that may be developing, and also check against the examinee's statements to confirm whether you have enough evidence of a certain diagnosis.
So what's a clinical interview?
A clinical interview is a very comprehensive interview. It includes a person's entire life history, as well as very specifically looks at any symptoms they might have. This can start as far back as birth. You might find out if there were any issues with their delivery, any genetic issues, any intellectual issues. How did they do? What was their home life like? How was discipline handled? What's their relationship with their primary caregivers? Were they raised by an aunt, an uncle, their parents? How many siblings do they have? How do they get along with their siblings? How many times did they have to move? Was there any abuse? Did they have any really significant life experiences that come to mind when they think about their childhood? How were they as a student? Did they need special services? Did they get in trouble at school? And you do this, you continue on high school. What were their hobbies? Did they play sports? How many friends did they have? Did they have any trouble keeping those friendships? Then you get into adulthood. Did they go to college? Did they not go to college? How come? What sort of jobs have they held? How did those jobs go? How did they end? That's always an important question. What sort of romantic relationships have they been involved in? How do they identify sexually, culturally? Let's see, what else? What sort of symptoms have they experienced? You go through the entire gamut of some of the main symptoms. You might screen for depression, any disorganized thinking. That means thinking that isn't necessarily in touch with reality, and any current distress they may be having today.
How did you conclude that Ms. Hurd suffers from the personality disorders that you identified?
So there was information that supported it from multiple sources. I conducted testing, including one of the main tests that I used. She obtained scores that were consistent with those diagnoses, and then I also, there was evidence of those diagnoses in her records and in her self-report.
Okay.